All right, so just a little heads up, I'm going to be going pretty off the cuff here. I just wanted to go into a little bit of detail about my warm up and mobility routine, specifically for patellar tendonitis. Um, I've dealt with it for almost 2 years now, and it's progressively gotten much better, but it's still lingering. It's my right patellar tendon. I even had like a debridement surgery, which I thought was the issue. I thought it was tissue rubbing over the bone, which I did have, but it didn't really help too much. So now I've had to revamp my entire workout routine and pretty much my entire life revolving around my patellar tendonitis. It is a nasty, nasty injury and issue to have. So, yeah, I just want to go into some detail. Basically, every time before I work out, which is between 3 and 4 days a week, I do a um, kind of a 20 to 40 warm up routine, um, incorporating a little bit of flossing, which are the bands I've wrapped above and below my knees that blast a little bit of blood flow, or basically prevents blood flow into your knees. And when you take them off after doing some activity, it rushes blood back into the joints. So I start out with that, do a little bit of mobility and squats because I'm not squatting right now. So I'm trying to keep basically just trying to keep the movement down. And I do a little bit of shoulder mobility because I've always had a problem with chest tightness, upper back tightness, specifically my lats and teres major. And yeah, I use a band or PVC pipe and do some squats, some lower body mobility while I floss and do some overhead shoulder mobility work. So it's kind of all inclusive, and that's basically just what I start with. I get some blood moving into my joints, into my knees, and I pack up the floss. That's all I do for the day. And then I move on to basically, let's see what I'm doing next. Oh yeah, I'll either do or I'll most likely do hip circle right above my knees, or a small rubber band on the bottom of my feet, and I'll do some shuffles and some monster walks. So those were monster walks, and then I'll put them at my ankles, or like I said, a rubber band around my feet, and do uh, some side shuffles. And that basically is targeting my glute med to strengthen it, and basically strengthen all my weak points, because as a power lifter you tend to be hip, quad, and hamstring dominant, and you neglect all the other muscles. So this is something that I've actually incorporated from my physical therapist, who got it from the the company Gold Medal Body, which I will link in the description. This My physical therapist, Seth Burke, I'm sure he's fine if I say his name. He's amazing. He has been following Gold Medal Body's routines. They have 4 routines for sale, and they're really just great for getting your body to move the way it should, and basically for just strengthening all your stabilizers and small muscles. And so this is it's a downward dog walk. That's what I write down. So I go forward and backward, and that opens up my lats, my hamstrings, my glutes, my calves, and is just a great core and shoulder strengthener. It's great. Ever since I've done it, I've noticed a lot of increased flexibility and just really just stronger in every movement. Um, so this is painful. This is the frog. So you start out in a frog stance or a deep squat. Um, Bring your hands forward and lift your legs up and hop, and then land in a deep squat again. So I go forwards and backwards and then side to side, which you'll see. And that really just opens up every single joint in your lower body and gets you to move and to get into a deep squat comfortably, which with patellar tendonitis, I stopped doing a lot of quad movements, a lot of all my squats. I've just started reintroducing box squats, and I noticed that my adductors are just insanely tight, and the frog hops are good at loosening up and um, getting you more flexible in those deep squat muscles. So yeah, so those were just a few examples of some of the work and mobility that I do. And then I'll do some trigger point therapy, or it's called just, what is it? Deep tissue release work. And I actually got that from this book. It's called Supple Leopard by Dr. Kelly Starrett. And my physical therapist also recommended this book. He's a big advocate, my PT and Dr. Kelly Starrett are big advocates for trigger point therapy to mobilize your joints and your muscles and get into the deep fascia. And really, I was a little skeptical at first, but I had a lot of issues with my upper back and shoulder tightness. And ever since I started doing some trigger point therapy, I have these big rubber balls with indentations. So it's bigger than a lacrosse ball that I use for my chest. And then I use it's like two lacrosse balls, but they're linked together. I use that for my back and quads and other various large muscle groups. And it's, like I said, I was skeptical at first, but they have been great for increasing my back flexibility and chest flexibility too. So yeah, that's basically it. I sometimes do more, I sometimes do less, but basically I'm doing a lot of movements that open up my shoulders, my chest, get me into the deep squat positions that I've been neglecting. I do some trigger point therapy and basically fascia release for tight and nagging muscles that are bothering me, and it really seems to help. And then I'll do some work that Gold Medal Body, those programs recommend, and that's frog hops and the downward dog walks. And they've been excellent at increasing my flexibility and really just overall strength and uh, strengthening those small muscle groups that you tend to neglect as a bodybuilder and powerlifter. So yeah, that's basically it. Like I said, this video was totally off the cuff and hope that it helps some people. I'll go more in depth with some things, but just kind of starting from scratch here. This is the first warm up and mobility video that I've made, so I hope you enjoy and I hope it helps, especially those struggling with patellar tendonitis. It sucks. That's just putting it lightly, but my patellar tendonitis has been getting better over the past few months, and I'm starting to have days with little to no pain, so it's working. So I hope you enjoy. Please check out my other YouTube videos. I do a lot of yoga videos and pretty much anything regarding mental, physical, and spiritual health that I hope helps others going along their own journey. So yeah, thank you for watching.